one of the things that I think you brought up was that you've been able to use some of the information through Sensi to help with educating not just the family, but the caregivers as well. So I want to talk a little bit more about that, specifically in education. So we talked about the care report briefly. The care report is what you're seeing on the screen on the side there. And this really can be valuable, I think, both internally and externally. Kind of like Tracy alluded to, internally for those opportunities for training or additional education for caregivers, as well as an opportunity to sort of give praise to those caregivers who are doing a great job, or identify caregivers maybe who we can move up into a different position or adjust in their role to help other caregivers. The other obvious one externally is for family and the client themselves, just to give them something tangible. Here's what we're working on. Here's what's being picked up through the data, and here's kind of how we're responding to that. I think it can serve, especially in those really stressful and unpredictable situations with clients on hospice, to give something tangible to say, we have a plan, we have it down, and you can take a look at it. And here's an option for you guys to have some idea of what we're seeing. So I think the care report can be really valuable there. In addition to that, Cindy, you mentioned this earlier, speaking about what Sensi was picking up with a doctor, with a physician. So coordinating across the whole continuum of care, as we know, a lot of home care clients are also receiving other services, whether home health or otherwise. And so being able to use a tool like Sensi that's there all the time to provide information to other stakeholders, and really just give everybody a source of truth across that entire continuum, I think can be really valuable. And then lastly, like we mentioned earlier, to just validate what is happening. We're making these adjustments to your care plans, or we're making these adjustments to ours, and here's why. We're not just saying this, we have the evidence for it, and we're going to share that with you and show you specifically when those things occurred and why we're responding the way we are.